Hello everyone, Dr. Amanda here. For those of you who don't know me, I am the owner and veterinarian at Shepherd of the Hills Veterinary Clinic in Branson, Missouri. I'm making this video today for people who either have a newly diagnosed diabetic patient or maybe they have a diabetic pet and they're not sure exactly what to do, or they don't understand it, or they need help with some things. By the end of this video, you should know how to help your dog or cat with his or her diabetes. Also, we do create written handouts. So if you want something written down with all this information, just call, text, or email, and we can send that to you. The first thing I would like to make very clear about diabetes in dogs and cats is that it is not the same as with humans. So while there is some overlap in the control, the diagnosis, the pathology, and the maintenance of diabetes, there are a lot of differences, and I encourage you to throw away any knowledge that you may have of diabetes as it pertains to humans and pay attention to this video and learn it as if it was new material. Let's just start with the basics. What is diabetes? So insulin is made in the body by your pancreas. There are special cells called the islet cells, and they produce insulin in response to how much glucose or sugar is circulating in your bloodstream. When the pancreas stops producing insulin, the glucose will be elevated and get really high. This can cause increased thirst and urination, lethargy, anorexia, vomiting, tremors, even up to seizures, and in severe cases, coma and death. So it is a very serious condition. Let's talk about dogs and diabetes. Unfortunately, with dogs, the pathology is not the same as humans or cats. When a dog becomes diabetic, it is usually because the islet cells and the pancreas have been destroyed or the body stops producing them. That means, unfortunately, they're not likely to go into remission. Once a dog is diabetic, they are always diabetic. And you could have a dog on a great balanced food, a proper exercise program, and doing everything correctly, and they may just develop diabetes. We don't really understand why it happens in dogs, but a lot of times it's more of a genetic thing, and there's nothing anyone can do to reverse it. So let's talk about how do we know if someone has diabetes or not, other than the clinical signs. We measure the blood glucose. Now, as far as my knowledge goes, I'm pretty sure that most all creatures are the exact same. Dogs, cats, humans, horses, guinea pigs, you name it. We all have the same blood glucose concentration of about 80 to 120. So anything outside of that range is considered abnormal. Now, the biggest difference between dogs and cats and humans is dogs and cats are very tolerant of higher levels of glucose than humans are. But all species across the board are not tolerant to low glucose or low blood sugar. And I will talk about that more in depth later. Let's talk about now what is a controlled diabetic versus an uncontrolled diabetic. When we talk about a controlled diabetic, that is basically a normal, happy, healthy animal. They're eating and drinking normal, they have energy, they're at a good weight, they're feeling good, and they're being themselves. An uncontrolled diabetic is a pet who has increased thirst and urination. They might be having potty accidents in the house. They also probably don't feel very good. They don't have as much energy. They're lying around and they're lethargic. They might not be eating as much and they're losing weight and sometimes even vomiting. So those are all signs that the blood sugar is not in control. Now let's talk about the management options for dogs with diabetes. You have about 4 choices when it comes to what can you give your dog to manage the diabetes. And it is insulin. There are 4 types of insulin. The first choice is Humulin N, and as its name implies, it is technically made for humans. The good news is most dogs can regulate just fine on Humulin N. It is the most economical option. at about $35 per bottle. My guess would be about $25 per month when you factor in syringes and everything like that. The downside to it, sometimes it is a little bit more difficult to get them regulated, but once you do, they do just fine. And they may require higher doses of insulin over time compared to some of the other options. So the second option is Vetsulin, and as its name implies, it is made for veterinary medicine, especially for dogs and cats. It is at a slightly higher price point, about $75 per bottle, but you don't usually need quite as much insulin, and I can achieve regulation quicker and smoother with Vetsulin than I can with Humulin N. So it is a really good, also budget-friendly option. It's just a little bit more than Humulin N, probably by about 20 bucks a month, give or take, depending on the size of your dog. The third choice is Prozinc. This one's pretty nice because you only need once a day insulin dose versus all the others do require twice a day dosing. So Prozinc is the only one that you can get away with once a day dose, and that is really nice. Price point wise, you're probably going to spend a little bit more, maybe around $75 a month, but still not that bad. It is made specifically for dogs only, and it does a very thorough job of getting them regulated. The last choice is Lantus. This is by far and away the most expensive option. It's going to run you about $400 a bottle, probably around $150 a month when you factor in syringes and things like that. But the reason is because it is super safe. So all insulins are designed to just drop the glucose. That is all they do, is just drop the glucose. Lantus, however, has a stimulatory effect. So it will drop the glucose, but when it hits a certain threshold, if the body glucose is getting too low, it will start to stimulate glucose and it will help bump it up. So you do have much less risk of the patient bottoming out and going into hypoglycemia, which can be very dangerous and even fatal. So that's the benefit to Lantus and why it's got the higher price tag. So this is my cat, Dobby. He's a nice subject because he's hairless, so you can see the skin, but also he's very food motivated. This is not actually insulin because he's not diabetic. This is just saline, but I'm going to show you exactly how to give the insulin. Feed them, make sure they eat, and you just take a little tint of skin, pop it in there, and inject. Sorry, I know. And there you go. That's it. Saline does sometimes sting a little, but most of the time they won't even notice because insulin does not sting. But that is it. It's pretty simple. I did it all by myself, even with a temperamental little cat. Thank you, Dobby. You've been very helpful. We do also offer demonstrations in real life. If you want to bring your pet in and have a diabetic demonstration, you just call to schedule that. We can show you exactly how to give it. It goes under the skin, but you can put it in the muscle, in the vein, in the artery, intradermals in the skin, not under the skin. You just have to get it in the animal and it will work. So don't get too stressed if you don't do it quite right. But the recommended way is at a 45-degree angle and you make a skin tint and just give it kind of just like I did, what you just saw. The reason we suggest under the skin is because it is the least painful spot. That's it. If you give it in the muscle, it'll work just as effectively. That does just sting a little bit more. So that's why we don't generally recommend that. Also, we recommend rotating the sites. It is not recommended to give insulin on the scruff of the neck. It is actually recommended to do the shoulders and the hips or the sides. And so I would usually say, especially if you're giving insulin twice a day, do like the left shoulder in the morning and the left hip at night, and then the right shoulder the next morning and the right hip the next night. We can shave the hair off your pet in like little squares or something so you can help see the skin while you're learning if you think that might help you at all. You just let us know if that's something you're interested in. Now let's talk about feeding schedule, what to feed and when to feed. It is really important that diabetics learn to eat meals and not just leave food out all the time. I recommend every 12 hours because that is when we're going to give the insulin. Now, if you're on Bexacat or Prozinc, those are once daily dosing, but I still think every 12-hour meal feeding is the healthiest for your animal because the glucose is naturally on a 12-hour cycle. You can regulate most pets on whatever they were eating before they became diabetic. 90% will regulate just fine. But if you do want a prescription dog or cat food, there is one called MD that is for glucose balance and control. It will allow you to lower your insulin doses very slightly. For cats on Bexacat or Cinvalgo, the dose is the dose. It does not matter what you feed, how much your cat weighs, what their glucose reading is. The doses are all the same, but MD would help regulate them even better. I recommend they eat every 12 hours, and I recommend you feed them and then give them their medicine or their insulin. You always want to watch them eat, then you want to give them their meds, because you don't, especially with insulin, want to give them a full dose of insulin if they do not eat food. They have to have the glucose in their body to drop it to where you need it. If they don't have the glucose there and you give the insulin, you may drop them too low. So it is important to have them eat. It doesn't have to be much, just a few bites. And while they're eating and distracted with food, like you saw in my demonstration, give them their insulin. Pretty easy peasy. If your schedule does not permit every 12 hours feeding an insulin, that's okay. You can do 11 and 13. You could probably even get away with 10 and 14. Much past 10 and 14, we might start to have problems. So I would really encourage you to stay at least at 10 and 14, or as close as you can get to 12 and 12. If you can't get any closer than 10 and 14, discuss this with your veterinarian because we may have to adjust the dosages. Let's talk about treats. Every good animal deserves a good treat. However, too many treats make us a little fat, let's be honest, and the wrong treats will dysregulate the glucose. So the best treats are in moderation. That's the first thing. And low carb, low fat. That will help keep the glucose regulated. They do actually make special treats for diabetic patients, so I would consider that, or you can research proper treats. Never give treats on days where we will be rechecking the glucose. That is very important because it does affect the numbers and we will get false elevations. So on glucose check days, no treats. On other days, yes, every good pet deserves a good treat. Just make sure we give them the right treats and in moderation. Now let's talk about the rechecks. If you have chosen insulin as your drug of choice for your pet, then they will need at least spot glucose every 3 days to 2 weeks until they are regulated. Every patient's a little bit different on how long it takes to achieve regulation. Some will achieve it within 2 or 3 visits. Some may take 10 visits. I can't really predict that. We want a maximum of every 3 days. We don't want to do it too much before then because the body hasn't had time to adjust. And unlike humans who micromanage our glucose by checking multiple times a day, that is not actually beneficial in dogs and cats because they don't eat the junk food that we do. So you don't have to check it. They're not out here eating giant cheeseburgers and ice cream cones. If you're feeding them every 12 hours, the same thing like you should be, you'll be fine. So resist the urge to micromanage checking the glucose. It is not going to help you. So when do we check the glucose? We want to check it ideally 6 hours after insulin administration. Now this is a spot glucose check. It can be affected by many factors such as what they ate that day, their excitement level, their stress level, things like that, how high is the cortisol in their body. So we do have to take those spot glucose checks with a grain of salt. If we get a really erroneous reading or something that doesn't make sense, we may be like, that's not quite right. and we may not do anything except schedule another recheck another day. Once we get them in a good regulated range, then a month after they're regulated, we will come back and do a fructosamine check. That is an A1C in the human world. The fructosamine is really nice because that is an average of the glucose reading for a month. And it is not affected by stress, and it is not affected by what they've eaten or their excitement for that day. It is a very, very accurate reading, and it is ideal. But we cannot check a fructosamine until they are regulated. Otherwise, obviously, it'll be high because they've been high. A month after they're regulated, we'll do a fructosamine check, and that is if everything goes ideal. So, what if things aren't going ideal? What if we are, 3 months out and our glucose readings are all over the place? We can't get them regulated. We are adjusting insulin and it's not making any sense. At that point, your veterinarian may say, hey, let's admit him to the hospital. I want to do something called a glucose curve. We also may say, well, let's repeat blood work and make sure there's nothing else going on, or do a urinalysis, because even something as simple as a UTI can cause the glucose readings to just be out of control. So it is not out of the realm of possibilities that we may need to do more diagnostics and special testing even after we know they have diabetes. Now let's talk about what numbers are we going to aim for when we are trying to regulate our patient. As I stated before, the normal glucose reading is 80 to 120. However, with dogs and cats, we will not have that goal in mind. So a lot of cats and dogs will tolerate high glucose really well. We've had patients with like 540 or 600, and they're walking around honestly doing relatively okay. They're peeing a lot, they're drinking a lot, they kind of feel a little bad, but all in all, they're stable. If that was a human, we'd be in the hospital dying. Humans are super sensitive, and any glucose reading over like 160 and you're freaking out and you're trying to give insulin. But the one thing all species have in common, if we drop below 80, it is dangerous. When you get to about 60, you're getting the shakes, you're feeling queasy and hot, and you just don't feel good. Lower than 50, you're probably starting to vomit maybe. Lower than 40, and to be quite honest, you're probably on your way to having full-blown seizures and dying. So a low glucose is much more dangerous than a high glucose. And because we cannot micromanage our patients, and our patients can't tell us, hey, I'm feeling a little shaky, I want to eat a candy bar right now, we have to err on the side of a little too high than a little too low. So our glucose goal range is 100 to 200. If that was a human and they were at 200, the physician would say that is much too high, increase your insulin. However, as a dog or cat, if we measure it and it's 200, we are going to say that is an excellent reading and we're going to stay where we're at. So keep that in mind in the regulation process. Our goal is to reach a glucose of between 100 and 200. Also, I want to take this time to clarify, dogs and cats don't get a lot of the complications that humans do. The diabetic neuropathies where humans have circulatory issues and their feet and hands can even, necrose and have to be amputated. We don't have those problems in dogs and cats. So you don't have to worry about, their limbs falling off. That is not going to happen because their blood sugar is 170. Now, unfortunately, cataracts are pretty common in dogs and cats, and to have their glucose regulated, it is the best prevention of cataracts, but anything below 200 is going to prevent them just as much as below 120. So again, our goal is 100 to 200 for best preventative medicine for our dogs and cats. After your pet is successfully regulated and we've had a good fructosamine reading, I recommend a visit with your veterinarian and a fructosamine level reading every 6 months. Now, if your pet is sick or something, obviously he needs to come in sooner. So now let's talk about things to never do with your diabetic pet. Please do not adjust the doses of your diabetic pet's medication without consulting your veterinarian. We have very specifically chosen these doses, and there is a very narrow safety range. Changing them just because you think it may work isn't going to work in you or your pet's favor, and it can even lead to fatal complications. Please do not adjust the doses of your medications without consulting your veterinarian. This is very, very important. When should you call the vet? If you have a diabetic pet and something is wrong, when do you call your veterinarian? Well, let me just tell you, when a diabetic pet gets sick, they get sicker quicker. So the answer is if there's anything wrong. I usually give them about 36 hours or 3 strikes. And I'll tell you what the 3 strikes are. Let's say you feed Fluffy breakfast and he does not eat. That is okay. Sometimes we're just not hungry and we just don't want to eat that day. No big deal. If Fluffy's on insulin, give them half of their dose of insulin. So if you're giving 6 units, just give them 3. Don't worry about it. Go on about your day. Now dinner time comes along, so we're 12 hours later. You feed Fluffy dinner. Fluffy doesn't eat. That's okay. Don't get too worried. Once again, give half of your dose of insulin. By the way, if your cat is on Bexacat or Cinvelgo, you give the full doses. There's no half doses here. Just go ahead and give your full doses. Only insulin is needed for half doses if they're not eating. Now you're on the 3rd meal and Fluffy does not eat. Now Fluffy needs to come in. Something is wrong. So that's my 3 strikes and you're out, which is 24 hours. Breakfast, dinner, breakfast again. They're not eating. They need to come in. Otherwise, any other symptoms, lethargy, vomiting, diarrhea, suddenly experiencing lack of control, like we reverted to increased thirst and urination, we're losing weight, things like that. Yes, call your vet. They probably need to be seen. Something as simple as a UTI in a diabetic can wreak havoc. And they are prone to getting things like that. So we need to see diabetic patients if they're not feeling good. Remember that when a diabetic gets sick, he gets sicker quicker. That's my motto. Now let's talk about one possibility, especially when you're using insulin. There's something called bottoming out. This is a very dangerous situation that is potentially fatal. And you can save your pet's life very, very easily. So the symptoms of bottoming out, which are hypoglycemia, meaning he has fallen too low below the glucose rating. The first symptoms we've discussed earlier, they may get the shakes, so you'll see some tremors. They're weak, they're stumbling, they may be vomiting. They will very quickly escalate into loss of consciousness, full-blown seizures, and coma. If you see any of these things in your pet, shaking, tremoring, stumbling around, loss of consciousness, seizures, or completely unresponsive, the first thing you do, stay calm. The second thing you do is get your maple syrup from the cabinet, because most of us all have that. If you don't have that, for a diabetic patient, you need to stock that. That is something you should have in your house. And you pour some maple syrup or Caro syrup on their gums. It is high in fructose, which is a cousin to glucose. It will spike that sugar up really fast. They don't even have to swallow it. It'll absorb through the gums. Put that on their gums immediately, just like a teaspoon. It doesn't have to be very much. And then immediately drive them to the vet. You do not need to rush. Do not get a speeding ticket or in a car wreck. Just calmly and safely take your pet to the veterinarian. Hopefully they will start to come out of it just from you putting the syrup in their mouth. But if they don't, once you arrive to your closest veterinarian, hopefully it's yours, but if it's not, if you're on vacation, go to the closest vet. If it's after hours, go to the emergency vet and tell them he's a diabetic. They will take him and immediately check his glucose. The last thing I want to talk to you about are a couple of things. One is a complication called diabetic ketoacidosis. This is something you have to watch for. They may not be passing out or having seizures or things like that from hypoglycemia, but if the glucose gets too high and they go into a hyperglycemic state, they can get diabetic ketoacidosis, which can be life-threatening. and they will probably need hospitalization and insulin CRIs. And the symptoms look strikingly similar to just unregulated diabetes. They're not feeling good, they're not eating, they're drinking a lot, they're peeing a lot, but the symptoms are more profound. They're usually completely anorexic and severely lethargic. And all they want to do and all they live for is drinking water. And they might even pee on themselves because they can't control it. This is a life-threatening condition, and you need to get them into your vet. The last thing I want to talk about is something called the Freestyle Libre. It's very popular in the humans. You'll see a human wear them on their shoulder and is a continuous monitor for the glucose. It is very nice because you can wave your cell phone over it and it'll measure your glucose reading without having to stick yourself, or if it's a pet, without having to bring them into the vet. So this is really helpful for the regulation phase. Maybe your cat or your dog is just like, I hate going to the vet. I want to eat everybody's face off. I am super stressed, which isn't going to give us great readings anyway, because as we know, stress affects the glucose. This is an excellent option for those pets. It is a little bit pricey up front. You'll probably spend $100 to $170 to have it implanted. They usually will shave a spot on the side and plant it right there. And then they will really need to wear a t-shirt because they will try to scratch or chew it off. They're animals, that's what they do. But then you can download the app on your phone and wave your phone over it. And I usually have my clients send me an email every few days of all their glucose readings, and I can adjust their medications without them having to come in. The monitor lasts 2 weeks. After that 2-week mark, you can decide if you want to put it back on, or if they're regulated, we can convert to fructosamine readings after that. I will say, with the Freestyle Libre, I can usually achieve control and regulation way quicker, usually within that first 2 weeks. But it's a little pricey up front, and there is the high risk of, even with a t-shirt, sometimes they're Houdinis and they can knock it off. And there goes your $170 down the drain. So there are a few complications with the Freestyle Libre, but it is an excellent option if we can get it on your patient and keep it on your patient. If you have any questions about diabetes and your pet, at Shepherd of the Hills Veterinary Clinic, we do schedule diabetic consults and demonstrations. Just call us today and we can get that scheduled, and a technician or a doctor will come in and show you how to give it or answer any questions you may have. Otherwise, I hope that you find this video helpful, and we look forward to getting your diabetic patient happy, healthy, and living a perfect life.